Hi, everyone. My name is CECILIA CLARKE, and I'm President and CEO of Brooklyn Community Foundation. Thank you so much for joining us today. We're very excited about this conversation. It's so critical to Brooklyn and to looking at this crisis in a very important way. Before we get started, we would like to take a moment to do a moment of silence to honor all of the lives that have been lost through this pandemic. Thank you. So welcome to our 5th webinar in the series. These webinars focus on the issues that are particularly critical for Brooklyn and how this crisis has been manifest in Brooklyn and how our Brooklyn COVID Response Fund has been addressing many of the challenges and the myriad challenges that have come along. Today, we are incredibly grateful and honored to be joined with featured guests Heather McGhee and Lurie Daniel Favors, who are both strong advocates and activists working for racial justice and racial equity. And they will be speaking to the issues of how community of colors have been so disproportionately impacted by this crisis. First, I'd just like to take a moment to discuss our Brooklyn COVID Response Fund and what we think makes it distinct. And I would like to say at the outset that we have been really moved and grateful at how incredibly generous people have been. I'm pleased to announce that we've raised almost $3.2 million, and that is almost entirely from individuals and families. So this is truly an effort that reflects the neighborliness of Brooklyn and the generosity of Brooklyn and people looking out for their community members. So to start, we were actually one of the very first funds to be launched. We got started on March 12th, just as everyone was starting to work from home. And one of the things that we knew right away was that Brooklyn would be, in fact, gravely impacted by this crisis. This is not a prediction we wanted to come true, but sadly it has. And one of the very first decisions we made was that we felt very strongly that in the face of the crisis, it's actually the time that you stick by your values, that you don't behave differently, and that you respect the ethos that you have always done. And for us, that is working with a racial justice lens that we've had at the foundation for many, many years now. And we knew that this pandemic would, of course, disproportionately impact people of color. So we started with that. We started with a racial equity lens. Since, and now we've done 9 weeks of grant making, I'm pleased to report that over $1.5 million have been distributed in Brooklyn for emergency funding. And I think one of the things that has made us distinct as a fund, well, one is that we're very, very low burden on nonprofits, on our beloved nonprofits in this community. Our application consists of 2 questions, only 2 questions, and we turn requests for funding around in a week. And this is quite unusual. And I think that nonprofits are grateful to us for trying to be as easy as possible while they face the crisis in their communities. In addition, most of our, in fact, over 70% of the nonprofits that we have funded are run by people of color. And if you know anything about the statistics about who runs nonprofits in this country, that is quite a percentage. And in addition, over a third of the grantees that we have funded are under $500,000 a year in a budget. So these are very small grassroots organizations truly embedded in their communities. These are the trusted go to nonprofits in their communities, led by impacted communities, serving impacted communities. So today, the conversation is extremely important for many reasons. As many of you know, Brooklyn is at the epicenter of this crisis, with the highest rate of fatalities in the nation. The hardest hit zip codes place Starrett City and East New York at the top of this list. The hardest hit neighborhoods, unsurprisingly, have high concentrations of Black and Latino people, as well as low-income residents, which proves what we already know. Race and income are the key factors that determine who is impacted the most by COVID-19. And one note I do want to just say right here that beautifully timed, although not intentionally timed, we have an op-ed piece in the New York Daily News about this very topic. And we encourage, I believe it'll be distributed on the chat portion of this webinar. We hope that you'll all take a look at this, and it'll give you some of the statistics I just gave you. But again, we see this as an effort to call attention to how critical this racial justice issue is. So today, I'm so honored to have these two women with us to discuss the myriad impacts of the public health crisis on Black communities. They will be joined later in a Q&A portion with our Vice President of Programs and Partnerships, Marcella Tillett. So, Heather McGhee. Heather is the former president of the inequality-focused think tank Demos, where she drafted legislation, testified before Congress, and became a regular contributor on shows like Meet the Press and Real Time with Bill Maher. She is also the co-chair of the Board of Color of Change, which has an advocacy and resource platform to support Black people during this pandemic, called theblackresource.org. Heather is the inaugural Brooklyn Community Foundation Fair and Just Fellow and the author of the forthcoming book, The Sum of Us, and you can find her TED Talk online entitled, What Racism Costs Everyone. Lurie is an activist and attorney with a long-standing commitment to racial and social justice. She is currently the interim director and general counsel of the Center for Law and Social Justice at Medgar Evers College right here in Brooklyn. Lurie has been at the center since 2015, where her work has primarily focused on civic engagement, including voting rights, census and redistricting, as well as educational equity. Lurie is also a contributing author to The Birth of a Nation, Nat Turner, and The Making of a Movement. Please join me in welcoming Heather and Lurie. And also please note that at the bottom of your screens, there is an option for Q&A. We encourage you to please ask questions. There are many people behind the screen who will try to do their best to get your questions out. And we look forward to an important and impactful conversation. Again, thank you so much for joining us. Thank you, Heather and Lurie.
Thank you so much, Cecilia. I want to just take a moment to thank the staff and board of the Brooklyn Community Foundation. When BCF approached me 2 years ago to become their inaugural Fair and Just Fellow, I wasn't as familiar with Brooklyn Community Foundation as I should have been as a Brooklyn resident. And as I got to know the commitment that the foundation has to lowering burdens on grant seekers and to having a thorough and exhaustive racial equity lens, I was truly impressed as the former leader of a nonprofit in a world where there are not too many of us who look like us in those roles. I recognize that this was something really special, and the fact that so many people, over 1,200 as far as I've been able to see in the last count, individuals and families have donated to the response fund, and that almost half of the people who and organizations that have received funding are new to BCF, right? That it wasn't just as the federal response has been who you know and who you already have a relationship with, just goes to show how important this institution is to our community. I'm really pleased to be joined here with Lurie, Daniel Favors, and just so excited for this conversation. And I want to get right into it. So first of all, how are you doing?
You know, that's a really good question. And in this moment, I am well. I am grateful for life. And at one point, it seemed really odd to be saying that or to be speaking in that type of manner to a question like, how are you? But the reality is, considering the past several months, I'm grateful to be alive. And, you know, I represent an organization at the Center for Law and Social Justice that for the past 35 years has been working in the racial justice space. And with all of our institutional memory, with all of the things that we have been exposed to as an organization, with all that I've been exposed to in my years on this earth, this has been certainly one of the most interesting and challenging periods, both professionally and institutionally and personally. So I'm very grateful to be here. I'm grateful for this conversation. And that the Brooklyn Community Foundation, which we are thankfully a recipient of past support from this organization. And I think I would echo everything that you said about their commitment to a racial justice lens and to supporting organizations that traditionally may not find themselves with that level of support. So in this moment, I am well, and I'm taking it moment by moment. I hope the same is true for you.
It is. Thank you. So let's talk about Brooklyn. What are you really concerned about right now? What are your priorities?
You know, I think there are a host of issues that I'm vitally concerned about, and I can list them in no particular order of importance because they're all ranked pretty high. One of my primary concerns is just the overall health of the borough and the health of the Black community within this borough. As you may know, the community, Brooklyn holds the largest Pan-African population of anywhere in the nation, and so what happens in Brooklyn is significant, as we are sort of the canaries in the coal mine as it pertains to how these issues may impact the rest of the communities of African descent across the country. I'm vitally concerned about health outcomes. As we know, we have been some among the hardest hit. As it pertains to contracting the virus, and then as it pertains to our survival rates for this virus. I'm concerned about our housing situation, both our community members who are currently in public housing, who are living in very cramped quarters, who have very narrow hallways, who have to navigate very small elevators and small stairwell spaces, where there are many family members, possibly in a 2-3 bedroom apartment, who are not able to socially distance, who are not able to quarantine should someone become ill. I'm worried about Black homeowners and Black tenants, both because our tenants need rent relief, and homeowners who are also landlords are not able to afford sustaining the burden of having tenants who have themselves been unemployed. And we know that in 2008, Black homeowners lost almost 50% of our collective wealth, which was held primarily in our homes. I'm worried about policing and violence, and I could wax poetic about that for forever, but I'm really worried about the fact that social distancing policing has become the new stop and frisk policing. We've seen just drastic differences in the way that enforcement has been meted out, whether it's on the Upper West Side or down in Chelsea, as compared to what's happening in Harlem and what's happening in Brooklyn. I am vitally concerned. I'm very concerned about small businesses, you know, from everyone from barbershops and hair salons and small stores and craft shops and artisans who make up such a significant portion of the business class within the Black community, and the fact that we are the last to get access to the loans and to the grants, which again makes response funds like the Brooklyn Community Foundation so vitally important. I am concerned about domestic violence and what's happening when our family members and our children are forced to stay at homes when home may not be a safe space for them. I'm terrified about what's happening in the schools right now, because we are getting calls, and we have from early on, about children who, yes, may have access to a laptop, but who have never, one, perhaps used a laptop before, or two, the laptops have missing keys. And so it's really hard to write a complete sentence when your laptop is missing the letter R, the letter E, or the letter S. I'm concerned about what's happening in homeless shelters, where children are having to share Wi-Fi that is horrific, and are not able to even actively engage in the lessons that are being provided for them. So these are some of the things that keep me up at night. As you can see, there are many. I'm also very concerned about what's happening with the census and the fact that the very communities that have been the hardest hit are also the communities that are now showing the lowest census response rates, because that is going to ensure that during the post-pandemic era, we will still not have access to the resources and the political representation that we need. I'm worried. I'm very worried, and I'm very concerned.
Thank you, Lurie. I mean, I think that you just gave, the list of the things that are top of mind for all of us, and I really appreciate it. I just want to add a few statistics to some of the things that Lurie said, because it's so important that we be armed with the facts. First of all, I think we all have gotten the message, if it's just from our lives, our families, our streets and neighborhoods, but also from the media coverage, that we and the Latinx community have been disproportionately hard hit in New York and across the country. I want to make very clear that when we talk about these disparities without talking about the reasons, what often happens is that our white neighbors and white decision makers put in their own stories about why it is that we are getting sick more and we are dying more. And so often the stories that are available to people are stories that pathologize Black people and blame Black people for our own disproportionate exposure to this pandemic. So recently, the first really comprehensive study about what is happening in majority Black counties across the country by researchers at AMFAR, the AIDS activist organization, and Emory University, found that yes, our disproportionately Black counties are accounting for over half of the coronavirus cases and deaths, even though we're just 22% of all counties. But, and this is critical, socioeconomic factors like employment status and access to healthcare were better predictions of infection and death rate than underlying health conditions.
That's right.
So what does that mean? It's not just that we have diabetes and heart disease, things that some people can say, as some Black commentators have said, well, we got to take better care of ourselves. It's that we are functioning in a society where employers and governments are allowed to leave us more exposed by paying low wages, not providing health care. We also saw that pollution was a co-determining factor, that we are far more likely to be breathing unsafe air. And of course, that has an impact on a disease that attacks our lungs. So let's remember, as we talk about our community, to push back on the negative narratives and to remember that part of the reason why we are more exposed is because we are essential workers, and our labor is knitting together and holding up this country right now, whether it's retail, healthcare, transit, government service, delivery, all of these jobs that we are overrepresented in and overexposed many times because corporations are not willing to give us the PPE that we need, to give us sick days and hazard pay, all these things that the Essential Workers Bill of Rights that's going through Congress, and that's right now part of what was just passed in the House, and we need to make sure that it stays in the Senate version of the next COVID response. All of those things could be a reality if we advocate well.
You know, Heather, I'm reminded, I was recently interviewed on Sirius, and one of the points that I wanted to stress was that the differentiated responses and results from this virus is not because of the differences in race, it's because of the systematic fusing of racism into our national policies. So when Black families are not allowed equitable access to loans that will allow them the ability to leave just the very tight urban centers that we live in, and that is something that is compounded by redlining and compounded by the foreclosure crisis. When we have inequitable access to healthcare, and as you mentioned, the jobs that we are employed in, I read a statistic that said only 1 in 5 persons of African descent are actually in a position where they have the privilege of working from home. And so these types of long-standing issues are not necessarily creating a crisis, they are revealing the underlying crisis that has been permeating the inequities in our communities for centuries, let's be perfectly honest, centuries. And most recently, as it pertains to our housing policies, our employment policies, the lack of access to capital that Black businesses have had for years. These are not new issues. The crisis that we're experiencing right now is simply showing, it's really highlighting what has always been. You're absolutely right.
Let's talk about Black businesses, because this is both a public health crisis and an economic crisis. And I would argue that the economic crisis is going to be deeper, already is affecting more people, right? Half of Americans making under $40,000 have lost their jobs in the past 3 months. A study this morning just predicted that half of those layoffs will be permanent, which is,
Wow.
you know, just, it shakes you to your core to conceive of what we are going to need to do to reignite the engine of our economy as this rolls on. And so let's talk about Black businesses. We and the Latinx community and the immigrant communities are, and of course there's overlap in both of those categories, are more likely actually to start our own businesses. Why? Because we are more likely to be discriminated against in other people's businesses. And so, but we are much more likely to do so without any kind of bank loan. To do so with our own savings, to do so with investments from friends and neighbors. And so when the program to help businesses recover came through the PPP program and the Small Business Association Administration program came through, it went first and exclusively to companies, larger companies, and companies that already had pre-existing relationships with banks. And so that, as a structural flaw in how the program was designed, left us out. I'm a proud co-chair of the board of Color of Change, the nation's largest racial justice online organization and membership organization. We have an advocacy and resource effort called the Black Response.org and hashtag the Black Response. And we just put out a study with Unidos US showing the degree to which Black and brown business owners have been locked out of the PPP system, just how many weeks most Black and brown businesses think they can stay in business, which is very few, and what we need and what Black and brown workers need. You can find that on the blackresponse.org. So I know what many people are doing in our community, which is making an effort right now to shop Black.
Right.
And I want to make sure that everybody knows about resources like Black Owned Brooklyn, which is an Instagram account and is constantly profiling Black business owners in Brooklyn. And so many of them, whether they're restaurants or cafes, our shops are still actually open in some limited way where it's just the proprietor taking in orders. So we need to still really make sure that we are focusing on supporting Black businesses. Our city, our borough will not look the same if we do not have our businesses on the street serving our communities. And then nationally, there's a website called WeBuyBlack.com, which is sort of an Amazon or an Etsy for Black businesses. People can sell things as well as buy from there. Do you have any other things that you're witnessing in the response and what we need to do to support Black businesses right now, Lurie?
You know, Black businesses are such a vital component of our community and our sustainability, and they are the job creators that fill in the gaps when other corporations that are not Black owned refuse to service, refuse to employ, refuse to promote. And so I think that when we're talking about our ability to retain political power, that is tied to the Black economy. When we're talking about our ability to possess the ability to self-determine, you know, the Kujichagulia element, if one would, that is tied to our ability to control the dollars within our community. And so being intentional about shopping Black and supporting Black businesses is vitally important. Spreading the good news about businesses that you have engaged with is vitally important. Using your internet cachet to promote businesses and to promote the work that they're doing. All of that really does play a role in helping these businesses to sort of sit in this space where they are underfunded, undercapitalized, and they have less capacity to provide the services that they traditionally do. And so I think while it is always a challenge, for some, there's actually a book called Our Black Year that talks about the one family's effort to buy Black for an entire year. there has never been more of a time, at least in my time on this earth, when it has been more important that we are intentional about supporting these organizations. And, you know, whether it's, you know, supporting their services that they have for sale, the items that they are actually distributing through their business, or supporting their GoFundMes and their requests for help and assistance. One of the things that I've seen that is a resurgence out of the Caribbean community and the African immigrant community is the resurgence of SUSUs, which is the inter-community distribution of funds. And for those of you who don't know what SUSUs are, I don't want to explain it right now for the sake of time, but really looking at the micro-lending genius that sort of exists within these communities and being supportive of that as well. Because right now it's literally taking all hands on deck. It's taking bank funding. It's taking whatever Scotch tape and Band-Aids you can use to put over the gap is what's needed right now.
We have a question that I think is relevant to this, and I want to make sure that we don't miss, as we talk about Black and brown businesses, the importance of the childcare sector.
Yes.
You know, this is an industry that is 94% owned by women, disproportionately women, immigrants, people of color. And, you know, this is also the care work that makes all other work possible. And so it has an enormous effect on our abilities to work successfully, to have someone to care for our small children. And of course, not having that has a disproportionate effect on single parents. And so what we're seeing right now in the city is that childcare centers are falling through the cracks. Either they were able to be essential providers of care to essential workers' children, and they got in on that early, or they've just been waiting, and they were ordered to close since April 6th. And there has not been a city response as to when they can reopen. There is the understanding that it's probably not the same timetable as the DOE, and they certainly don't have the resources that the public schools have, because these are mostly private nonprofit centers. And yet the state, which has a phased opening plan, doesn't even mention childcare, because according to the state, they never closed because it was seen as essential outside of the city of New York. So they are trapped in a limbo. So many of the women who own these businesses are Black women. And there was recent studies that across the country, we're at risk of losing half of our childcare slots. So this is not to mention what's going on with domestic workers. So this is another part of the Black and brown economic sector that is not getting enough attention, and that we will have rebound effects if we really do lose so many of these centers. One of the questions that comes from Anthony Blake is, what can I tell my people and community about relying or not relying on unemployment insurance?
I think
I can take that, or you can take that, yeah.
Yeah, so I think just as it pertains to the childcare comment, I think that is so key. There was a childcare center here in Brooklyn, Little Sun People, and they had applied for the first round and got denied. They applied for the second round, and it was because they reached out to their alumni network who were then asked to call the local elected official to apply pressure, that they were able to be considered for the next round. Many of our communities also live in childcare deserts, so it wasn't as if we had the overabundance of childcare spaces to begin with. But what has to be clear is that there is no return to normal if schools are not open and there are not places for children to be cared for. If you are a parent, you simply cannot go to work if your child does not have a safe space to be. And so it has to be that part of our advocacy is elevating these businesses, both because they are vitally important businesses, but also because they are an essential part of any community's ability to function and to thrive. When it comes to the unemployment and what's happening in this city, or in this state, quite frankly, because this is a statewide issue. I saw that there were, I think, over $10 billion in unemployment benefits had already been distributed. And yet and still, nearly everyone I know in my personal life who has applied is still waiting. People who I know who contact our center seeking assistance and support are still waiting. And today we saw that the numbers of unemployment claims across the nation increased by another, I believe it was 2 million plus. And so what we need our organizations to be doing is advocating, yes, for the loan programs, but also advocating that there are additional supports provided for the Labor Department so that they're able to process these claims. If you processed your first claim 2 months ago and you still have not gotten funding, that is 2 months where you have essentially had to access food banks, had to access other forms of support in order to get your needs met. And that is just an additional weight on the social safety net that is already tearing at the seams. And so these are things that our advocacy organizations really are going to have to increase. And I know that there was an increase in the amount of hires that were made recently, but quite frankly, we should be projecting out that these claims are not going to decrease. They're going to continue to come in, and there has to be sufficient supports at the Labor Department that would allow for the rapid processing of the unemployment claims.
Right. So the brothers' question was about NYCHA specifically, and I don't know, eligibility for NYCHA public housing is what I'm reading between the lines, that your NYCHA eligibility might be damaged by collecting unemployment insurance. Yeah, so if you have any information about that.
I don't have anything to that specifically, but I think this really does speak to why it's not going to be sufficient for us to just have an economic loan program. We're going to need a comprehensive community reinvestment program that's going to be able to speak to the multitude of issues that we're experiencing right now. So one-time infusion of funds is simply not going to be responsive to these types of questions. And these are the questions that are the life or death questions for the families in our communities.
Okay, so we're getting questions rolling in. I'd like to invite back Marcella Tillett, who's the Vice President of Programs and Partnership, open it up for more questions. People are giving great recommendations in the chat about resources and things to see. What you just said, Lurie, about not returning to business as usual is so important. And I think many needs, which are Band-Aids, right? People need Band-Aids, people are bleeding. But also getting to the root of the disease. And the disease is racial capitalism, right? The disease is an economy that is built on the exploitation of our labor and that has disinvested from our communities from the beginning, and particularly, in the past 50 years as our country has become more diverse. So I have some modest, I'm so sorry, somebody next door is doing some yard work. I have some modest hope about what is changing and opening up in our politics right now, where you see despite the stupid protests, despite the right-wing governors who are willing to open back up at the cost of our lives and our health and the lives and health of our workers, there is still 7 out of 10, 8 out of 10 Americans supporting doing everything that we are supposed to do for public health. And every single person, certainly every person in New York, but every single person I think in this country has in some small way or another done something that they maybe didn't think they would do to help their neighbor. That is a superpower. That sense of solidarity, a sense of wanting to know what else can I do? Can I sew my own mask? Can I put fruit from my fruit trees out on my block? Can I open up my home to somebody who needs it? Can I advocate for more PPE? I mean, all of these things that people are willing to do is so profound. And that becomes the springboard for political will if we get the political change that we need at the federal level, and if we have political changes at the state and local level that we need across the country as well. That becomes the fuel for a different kind of politics. And I do think it's up to those of us who organize and those of us who advocate to not let the noise of the right wing distract us from what is happening right now in terms of a sea change in people's awareness of racial disparities and racial inequality, and a sea change in people's willingness to do something for their neighbors and stand up and recognize that we are all in a shared situation of pain. Everyone's life has been impacted by this in some way or another. And we need universal health care. We need a universal guaranteed income. We need jobs that pay, and if we can't have them from the private sector, we need to do the work that needs doing in this country, whether it's building parks or childcare or taking care of our elderly or cleaning up our water supply. Those are all jobs that need doing, and there's no reason why we can't put Americans and Black and Brown Americans first back to work doing that. So there's some other questions I want to bring in. Going back through.
One of the things.
So yeah, I was just going to say, I have a question. I wouldn't want us to end this webinar without talking about what's going on in jails and prisons.
Yeah.
Yeah. Go ahead, Lurie.
So thank you for that. We're on the same vibration. I think what's happening in the jails and prisons is such a good microscopic example of what's happening across the broader portions of our community. So we know that if your name is, I don't know, Roger Stone, you're going to be considered for early release. If your name is fill in the blank person who has been convicted and jailed as a result of involvement in anything related to the current administration. Chances are, if you're a Paul Manafort, you're going to be considered for early release. If you have access to resources, connections, and capital, you are going to be spending, as a result of your COVID-19 exposure in jail, you will likely be considered eligible to spend the rest of your time at home. And yet we live in a state where, while there is the capacity to provide clemency for residents who are incarcerated, who are very elderly, for residents who are incarcerated who have served the vast majority of their sentence. What we also know is that there is literally no one who is being granted the types of clemency from our communities that they are entitled to. And that should be considered, and that should be centered. We know that the access to healthcare in our incarcerated spaces is minimal, and what is there is dismal. We know that our brothers and sisters who are away are able to make hand sanitizer labeled with the state's name and logo, but they're not allowed to use that hand sanitizer because it contains an alcohol content that puts it at the level of it being considered contraband. I think that we can measure what's happening in our society, yes, by how we treat women, yes, by how we treat children, and also by how we treat those who are the least empowered, those who are incarcerated. I think that what's happening right now across the state is a travesty. It is horrific that, we have groups that are actually writing amicus briefs right now to advocate on behalf of persons who are appearing before parole boards. These are seniors. These are people who need access to healthcare. And I think it is vitally important that we remain centered on those needs as well. I want to add to that also the concerns about mental health. We know that even before this crisis, the African descendant community and the Latinx community, the idea and conversations around mental health were not spaces that we were necessarily where we need to be as it pertains to recognizing mental health as a valid issue, recognizing access to mental health care and supports as a valid route to successful healing. And I think that we have to be clear that this event that we are living through right now is such a traumatic burden on the mental health sanity and the mental health capacity of so many people in our community that it is shocking to me that we are not flooding our communities with more access to mental health resources. I have a neighbor who lost his mother and lost his brother in the same week. I've lost 3 close friends of my own, and I have access to a great healthcare plan. I am one of the privileged 20% of members of the African descendant community who is able to work from home. And the mental health strain that I have been under, I can only imagine if I were an essential worker, if I were someone who lived in a home where I couldn't have access to social distancing or quarantining capacity should someone fall ill. And I think that, there's an organization that I've been working with since I was in college, actually, Sankofa Community Empowerment, and they provide weekly or monthly, depending on the location, discussion circles where people of African descent are able to really grapple with the way various issues have been impacting them. They look at it from a personal perspective, a community perspective, look at the history of the problem, and then think about what is their collective responsibility. And the last session that we held was on the impact of the COVID-19 pandemic on our community. community. And I cannot tell you how many people, whether they were cardiologists who were the only Black cardiologists working in the space, or whether they were an essential worker working with a group of other people of African descent who did not have access to PPE, the concerns about the stress and how the mental health strain is not just stressing them out mentally, but how it is impacting their physical bodies. That tended to be the bulk of the conversation. And I think we really have to, as we are advocating for all these other issues, we also have to advocate for an increased recognition of the mental health strain and what it is that we need and where the resources are at, where we can find support services, because the trauma of dealing with post-traumatic stress disorder on top of dealing with institutionalized racism and what Dr. Joy DeGruy calls post-traumatic slave syndrome, these are compounding issues. And when we look at how we push through this pandemic and come out on the other side, whatever our communities are going to look like, the mental health needs are going to be vast.
Thank you so much for raising that important point. I want to flag one resource that is not, specifically for people of the African diaspora, but is free for New Yorkers who are out of work, essential workers, educators, healthcare professionals, which is headspace.com, which is an app that people can use and a website that people can use to have meditation, mindfulness, exercise. And if you're unemployed, you can get a free 1-year subscription to headspace.com, which is something that the New York government did in partnership with Headspace. I'm going to move it over to Marcella to take us home now.
Thank you. Yes, thank you so much, Heather McGhee and Lurie Daniel Favors.
And as someone mentioned in the chat, just the trust for the people that we are losing. I want to, oh, hello?
Yes.
Sorry, I think we just had a little, yes. I just wanted to say there's something online called Naming the Lost, which is people all over the country naming the people we have lost, which is something that we have been denied, that public mourning. And it's going on right now online, so you can go to namingthelost.com. Go ahead.
Thank you for that resource. And I want to thank you both, Heather McGhee, Lurie Daniel Favors, for this really powerful conversation. For me, what it demonstrated was, again, the full scope of issues that impact people of African descent in this country that COVID-19 has shown a light on. We don't have the luxury of being able to prioritize one thing. We have to address everything because it's all interconnected. And I think this conversation really demonstrated that in so many specific ways. And so I thank you both for your generosity and your time this afternoon. I'm going to transition over to Cecilia to take us home. But one other point I want to make on that is that as we think about the moment that we're in and the immediate response work we've been doing as a foundation and the immediate response work so many of the organizations in Brooklyn have been prioritizing and innovating around, one of the points that Lurie brought up very early on around census and representation, and even Heather talking about the needs for advocacy and government response, that is kind of where we are looking ahead to, even as we're in the midst of this emergency. The need for long-term response, for long-term investment to change the conditions that create these outcomes for Black people in this country has to be a priority for everyone. So just as we're showing up today, and just as we've been so beautifully demonstrating our love for our neighbors in Brooklyn, that energy has to be maintained over the long haul. So I thank you all for illustrating how we can do that and what that looks like.
Please go to my2020census.gov and fill it out. Our lack of access to healthcare right now is partially due to the fact that in 2010 and 2000, we had an artificially low census count in Black communities and in brown communities. And those dollars that we do not have for PPE, for ventilators, for hospital beds is tied to census algorithms. We have gotten, the numbers right now are so dismal that if we don't get these numbers up, we are going to be locked into a mediocre, measly capacity to respond going forward, because our population count is tied to the dollars for these services. So please visit my2020census.gov.
Thank you, Lurie. And Cecilia, to you.
All right, you know, I actually had one more question, and I'm so sorry, and I'd pose it to both of you, although maybe Heather, I don't know, maybe this is more your realm, but as we look to long-term recovery, what would you like to see on a policy level, on the federal policy or local policy level? And I'm saying this because if the foundation and philanthropy can get behind advocacy, you know, what are the things we should be looking out for? So to keep it short, I'd say, what is the one or the two things you would like to see in a long-term recovery plan that would increase racial equity in this country?
So I think we need a wealth tax at the state level, a billionaire tax and a wealth tax. I think we also need to use that to fund community service jobs and public service jobs for our people. The private sector is going to take a long time to recover, and we don't have the time, but there's work that needs doing, whether it's contact tracing or vaccine deployment or childcare or elderly services, or, I mean, the list goes on for the needs that our communities have, and we need to employ our people to meet our needs.
I would echo that. And I think that we could just stick on that point. And the fact that currently the state budget is being balanced on the back of education services, on the back of cuts to healthcare, the fact that in the city, summer youth employment has been cut. There will be no parks open. There will be no pools open. The beaches don't have lifeguards. All of the social supports that we need are being cut in the sake of saving this budget. And a wealth tax on those who are not only wealthy enough to withstand it, but were wealthy enough to flee the city when the virus came to their communities, I think is something that would be vitally important for all of the communities in New York, particularly those, the melanated African descendant communities and Latinx communities.
That's great. Thank you very much. So just a couple of things I heard. Shop Black, nationally, locally, Black-owned Brooklyn, highly recommend it. On a policy level, fill in your census and tell everyone you know, fill in your census. This is it's so serious. It's 10 years of disaster if it's not filled in. On the federal policy level, wealth tax, community service jobs, and increased decarceration is what I heard, locally and on the federal level. Thank you all so much. So one thing I just want to say quickly about the Brooklyn COVID Response Fund is, one, if you're interested in applying for funding, you are responding to your community's needs in this crisis, please go to our website. It's very clear. Go to grant seekers on the Brooklyn COVID Response Fund. You cannot miss it. And obviously, if you have any questions, ask questions. There's an email there. In addition, and I have to say this, and I say this every time, but I loved what Heather said about this kind of collective compassion and neighbors, loving neighbors and helping neighbors. And it's what we've seen with this fund. We see it in the work of our grantees and in our communities. And we see it in the generosity of Brooklynites giving us $10, $200, $200,000, all levels. And this is an engine, this compassion is an engine for the work that's being done in Brooklyn in the face of this crisis. I ask you please to help us continue this work. We are spending this money. We are spending the money that is coming in dollar for dollar. Every dollar donated is going to be spent helping communities in Brooklyn in this crisis. So I would ask you please, as you've heard from these extraordinary women, this is a long-term crisis. It is not going away. It'll change shape, but it's not getting less serious anytime soon. We are here for the long term. As this Burroughs Community Foundation, please support our fund. A huge thank you to Heather McGhee and Lurie Daniel Favors. It was just really feeling it. You're extraordinary. We are just honored and grateful. Thank you so much. And a big thank you to our audience for tuning in. Grateful for everything that you're doing right now. Thank you.
Thank you. Thank you for the opportunity.